So Mr. B is a 55-year-old male with a past medical history of hypertension, presented to the hospital with the chief complaint of right elbow pain. The patient's elbow is red, tender, and swollen. Denies trauma or a spider bite. He tells you he keeps having these joint flares. Every few weeks, takes ibuprofen, then it gets better. Has a history of kidney stones, has not seen a doctor in 30 years because he thinks he's healthy overall. What do you think about the diagnosis? What is the differential that you should be thinking about here? How would you work this up and how would you treat? I guarantee you, you're going to have a case like this at least once a month. Okay, so a patient comes in with what we call monoarticular joint flare or joint pain, just one joint. It's tender, it's hot, it's swollen. So let's go over the case here because this is a real past medical history or history of present illness, as we say in the history and physical section. So the patient denies trauma or spider bite. Why do we think about that? So when we talk about that, we think about cellulitis, right? We talked about that in the infectious disease section, infection of the skin. So we'll go over the different diagnoses that you should be thinking about here, and then we'll talk about how to work this up. So the first thing that we need to talk about is what is your differential diagnosis when you see a red hot joint? Any joint, elbow, ankle, knee, whatever. Cellulitis, like we talked about here. So again, if we go back to the case, the patient denied any trauma, denies any spider bite. So trauma will tell you, maybe he scratched the skin and he introduced the bacteria into the skin, causing cellulitis. Spider bite happens all the time. A spider bites the patient or an insect or something, and then now they have cellulitis from it. So that's the first thing, okay? And we'll talk about how to differentiate between just a skin infection versus an infection in the joint itself. Septic joint. Now you have the infection in the joint itself, not just the skin overlying the joint.